A heartbreaking reality has emerged in Gaza. For the first time, famine has been officially confirmed, affecting over 500,000 individuals who are now facing severe starvation, extreme poverty, and preventable deaths. This alarming situation has been detailed in a recent analysis by the Integrated Food Security Phase Classification, IPC, which indicates that famine conditions are expected to extend from Gaza Governorate to the neighboring Deir al-Balah and Khan Yunis governorates in the near future. The urgency of this crisis has been underscored by several key organizations, including the Food and Agriculture Organization of the United Nations, FAO, UNICEF, the United Nations World Food Programme, WFP, and the World Health Organization, WHO. They have collectively called for an immediate and comprehensive humanitarian response as the number of hunger-related fatalities continues to rise. Acute malnutrition levels are deteriorating rapidly, and food consumption is plummeting. Disturbingly, many individuals are going for days without any food at all. These agencies have made it clear, famine must be halted at all costs. A swift ceasefire and an end to the ongoing conflict are essential to facilitate a large-scale humanitarian response that can save lives. There is a growing concern regarding the potential for an intensified military offensive in Gaza City, which could exacerbate the already dire situation for civilians living in areas where famine conditions are present. Vulnerable populations, including sick and malnourished children, the elderly, and individuals with disabilities, may find it impossible to evacuate. By the end of September, projections indicate that over 640,000 people will be experiencing catastrophic levels of food insecurity, classified as IPC Phase 5, throughout the Gaza Strip. Additionally, around 1.14 million individuals will be in emergency conditions, IPC Phase 4, while another 396,000 will be facing crisis conditions, IPC Phase 3. The situation in North Gaza is reported to be equally severe, if not worse, than that in Gaza City, yet limited data has hindered a formal IPC classification, emphasizing the urgent need for access to assess and provide assistance. Notably, Rafah was not included in the analysis due to indications of significant depopulation. The classification of famine is triggered when three critical thresholds are crossed: extreme food deprivation, acute malnutrition, and starvation-related deaths. The latest analysis confirms that these criteria have indeed been met based on credible evidence. Nearly 2 years of ongoing conflict, repeated displacements, and severe restrictions on humanitarian access have compounded the crisis. These factors, along with interruptions in access to food, water, medical aid, and support for agriculture, livestock, and fisheries, have led to a collapse of health, sanitation, and market systems, pushing many into starvation. Access to food in Gaza remains critically limited. The number of households reporting severe hunger doubled compared to May, and in Gaza City it more than tripled. Alarmingly, over 1/3 of the population, 39%, reported going days without eating, with many adults skipping meals to ensure their children have something to eat. The rate of malnutrition among children in Gaza is escalating at a catastrophic rate. In July alone, more than 12,000 children were identified as acutely malnourished, marking the highest monthly figure ever recorded and a six-fold increase since the beginning of the year. Nearly 25% of these children are suffering from severe acute malnutrition, SAM, the most dangerous form of malnutrition that can have both immediate and long-term consequences. Since the last IPC analysis in May, the number of children projected to be at severe risk of death from malnutrition by the end of June 2026 has surged from 14,100 to 43,400. Similarly, the number of pregnant and breastfeeding women expected to experience perilous levels of malnutrition has tripled from 17,000 in May to 55,000 by mid-2026. The impact of this crisis is evident, with 1 in 5 babies being born prematurely or underweight. This new assessment reveals the most severe deterioration in food security and malnutrition since the IPC began its analysis in the Gaza Strip, marking the first official confirmation of famine in the Middle East region. Since July, while there has been a slight increase in food and aid supplies entering Gaza, these efforts remain grossly inadequate, inconsistent, and inaccessible compared to the overwhelming need. Moreover, approximately 98% of cropland in the territory is either damaged or inaccessible, devastating the agricultural sector and local food production. Additionally, 9 out of 10 people have been repeatedly displaced from their homes. Cash is in critically short supply, and aid operations are severely disrupted, with many UN trucks being looted amid rising desperation. Food prices are exorbitantly high, and there is a severe lack of fuel, water for cooking, and essential medical supplies. The health system in Gaza has deteriorated significantly, with access to safe drinking water and sanitation services drastically reduced. Multi-drug-resistant infections are on the rise, and levels of morbidity, including diarrhea, fever, acute respiratory infections, and skin infections, are alarmingly high among children. To facilitate life-saving humanitarian operations, UN agencies have stressed the necessity of an immediate and sustained ceasefire to halt the violence, allow for the safe release of hostages, and ensure unimpeded access for a mass influx of assistance to reach those in need across Gaza. They have highlighted the urgent requirement for increased food aid, along with improved delivery, distribution, and accessibility, as well as shelter, fuel, cooking gas, and agricultural inputs, supporting the rehabilitation of the health system, maintaining essential health services, and ensuring a steady supply of health resources into and throughout Gaza are also critical. Restoring commercial flows, market systems, essential services, and local food production is vital to avert the worst outcomes of this famine. People in Gaza have exhausted every possible means of survival. Hunger and malnutrition are claiming lives every day, and the destruction of cropland, livestock, greenhouses, fisheries, and food production systems has made the situation even more dire, stated FAO Director General Ku Dongyu. Our priority must now be safe and sustained access for large-scale food assistance. Access to food is not a privilege. It is a basic human right. Famine warnings have been clear for months, remarked Cindy McCain, WFP Executive Director. What's urgently needed now is a surge of aid, safer conditions, and proven distribution systems to reach those most in need, wherever they are. Full humanitarian access and a ceasefire now are critical to save lives. Famine is now a grim reality for children in Gaza Governorate and a looming threat in Deir al-Balah and Khan Yunis, said UNICEF Executive Director Catherine Russell. As we have repeatedly warned, the signs were unmistakable. Children with wasted bodies, too weak to cry or eat. Babies dying from hunger and preventable disease. Parents arriving at clinics with nothing left to feed their children. There is no time to lose. Without an immediate ceasefire and full humanitarian access, famine will spread and more children will die. Children on the brink of starvation need the special therapeutic feeding that UNICEF provides. A ceasefire is an absolute and moral imperative now, emphasized WHO Director General Dr. Tedros Adhanom Ghebreyesus. The world has waited too long, watching tragic and unnecessary deaths mount from this man-made famine. Widespread malnutrition means that even common and usually mild diseases like diarrhea are becoming fatal, especially for children. The health system, run by hungry and exhausted health workers, cannot cope. Gaza must be urgently supplied with food and medicines to save lives and begin the process of reversing malnutrition. Hospitals must be protected so that they can continue treating patients. Aid blockages must end and peace must be restored so that healing can begin. For further details, you can access the IPC alert here. The Integrated Food Security Phase Classification, IPC, is a collaborative initiative involving 21 partners, including UN agencies and international NGOs, aimed at enhancing food security and nutrition analysis and decision-making. By utilizing the IPC classification and analytical approach, various stakeholders, including governments, UN agencies, NGOs, and civil society, work together to assess the severity and extent of acute and chronic food insecurity and malnutrition situations in a country, adhering to internationally recognized scientific standards. To learn more, visit here in www.ipcinfo website IPC Overview and Classification System /EN. This situation calls for urgent attention and action. What are your thoughts on the international community's response to this crisis? Do you believe enough is being done to address the famine in Gaza? Share your opinions in the comments.